So while we don't have anything that we can offer immediately as a treatment, except for one, I will talk about it because today there is gene therapy available for a very specific mutation. I'll talk about it. So invariably, there is no treatment that's available today. So some of the things that we are aware is that low vision devices does help significantly in helping their lives get better. Many of them don't, just by the correct glasses, magnifiers, or today with the phone, the accessibility options that we have, wonderful on the phone. So many of them are not aware. So, that is something that they can use. So in terms of actually advising what, they can do, one of the things that we do know that the people should avoid is exposure to a lot of sunlight, especially with people living in really hot countries. We advise that they constantly keep their eyes shielded, either by using a dark glasses or by wearing a cap, depending on whatever they're doing. So this is something that we advise. In fact, I even advise most of my kids that they're allowed to wear these glasses when they're in a classroom. Most of them do well with what we call photochromatic glasses, which sort of turns dark when they step out and sort of becomes white when they step back into a classroom. So that's one. The second thing is avoiding smoking. So nicotine is hugely detrimental to the health of the retina and the macula. And so that's one thing which I tell all of my patients across, that they have to reduce or stop exposure to nicotine, to the extent that it's not a great idea to even have an exposure to passive smoking. So exposure to bright sunlight and exposure to nicotine are two things that we have to avoid. There has been a lot of discussion about using oral vitamin A supplements. As a rule, I do not advise people to use vitamin A because we are still not very sure whether excessive vitamin A is beneficial. Whereas on the other hand, we know that excessive vitamin A can be very detrimental otherwise. So I generally do not recommend, oral vitamin A supplements. There are people who use oral supplements of, what we call antioxidants. The role of that is still very, very, doubtful. And I would rather that patients have it in the natural form in terms of, food, rather than have oral antioxidants as, supplements. So avoiding exposure to bright sunlight, avoiding nicotine, and trying as much as of, low visual enhancement devices that is possible. For example, many of these patients, while in retinitis pigmentosa, we talk about, the difficulties with night vision. Many of them also have difficulty with very bright lights. So most of them do very well, for our routine laptop use. Instead of having a white background and black letters, most of them do very well with the black background, either white or yellow letters on it, or being able to use magnifiers. In fact, I suggest many of them that they have touch screens because, one of the biggest challenges that, for example, software professionals with these, eye conditions have is they struggle to find the cursor. If you have a touch screen and you touch somewhere and you have, where the cursor is. So these are small things that help tremendously in their day-to-day life. And while some of them continue to drive, depends, of course, on the amount of visual field they have. Once they know that visual field is affected, I advise them very strongly that it's better that they avoid driving. And thanks to all of the Ubers and the Olas that we have, that's, doable today in a country like India. The last thing that I typically do is, we unfortunately do not have any specific support groups for these diseases.